My name's Linda Vanderbeek. I'm Dr. Mark Sims' physician's assistant. Otosclerosis is a disorder of the third bone of hearing. There's a stiffening of the third bone of hearing that does not allow sound to get to where it needs to be. And the stapes is the innermost bone, and it's the stiffening of that third bone. These bones vibrate and to allow, again, sound to get into the hearing organ so we can interpret that. So if that third bone of hearing is not vibrating properly, then we can't get the sound where it needs to be. Typically women, middle-aged women are more affected by otosclerosis, middle-aged white women in general. About 60% of these otosclerosis have a genetic component to them. 70% of people with otosclerosis, it affects both ears. Typically it affects one and then the other. One's usually worse than the other. So when we do surgery for otosclerosis, and there is a surgery for it, we always choose the worst ear first to make that the better hearing ear, and then we will go back and do the other ear. Because we have to have some sort of hearing loss before we will do a surgery. So it has to get to a certain point before it makes any sense to get a surgery. Really, the only other option is to get hearing aids. And they could do that in lieu of surgery. Instead of getting surgery, they can certainly get hearing aids as well. If they have a nerve loss and a conductive loss from the otosclerosis, sometimes we can get their hearing better where they would be more aidable, meaning that a hearing aid would work much better for them. Dr. Mark Sims will put a hole in the bottom of the stapes bone, the stapes plate, and then he will put a little prosthesis into that hole, which has a hook on it that hooks around the incus, and that allows the ear bones to vibrate so people can get their hearing back to where it should be. We don't know why some people get certain side effects and others. It doesn't matter with age. I mean, of course, if you're younger and healthier, you're not diabetic, I mean, you're certainly going to recover a lot faster and a lot easier. But between ages, as far as the symptoms go, the taste, there's not really any difference. Things taste salty. That's probably a big common one, is the saltiness of the food. It'll taste something like, oh wow, that doesn't taste like wine, or that doesn't taste like chocolate, or different foods. Some foods are okay, it's just certain foods that taste really unusual, and that will get better with time. Yeah, so typically what I would tell people if they're hesitant about the surgery, it's very little pain involved. The success rate is under 99%. Complications, so very few complications happen from this type of surgery. So if you feel that you have a hearing loss, it's important that you get a thorough hearing test to determine what type of hearing loss you have. The majority are going to be either fluid behind the eardrums or a nerve loss, but there's that small percentage of people who don't realize that there's a surgical option to get their hearing better when they have this progressive loss over years.